The neck has a lot of this kind of lymph nodes. I mean, I need to do an examination, but one of the highest possibility is that this is one of those reactive lymph nodes that I mentioned earlier, because there are lymph nodes even at the back of the head area, and this kind of lymph nodes, when they get inflamed, they become painful as well. And sometimes the size, when the inflammation settles, then the pain goes away, it becomes less tender. But overall, if it's been there for 3 months already, you should have it investigated, or you should have it taken a look at by one of your doctors. Because 3 months is a long time. Like I mentioned before, anything more than 4 weeks, you should consider have it checked out. Yeah, you shouldn't leave it alone. It sounds like it's a lymph node. And I mentioned before, I assume your daughter is younger. I don't know how old your daughter is, but generally in young people, the lumps in the neck can be just due to this kind of reactive lymph nodes. But if the ultrasound already doesn't show any kind of suspicious features of cancer, it's safe to just monitor and leave it alone. Having said that, I often tell patients to monitor themselves, monitor closely, because if it's a reactive lymph node, then it should not grow. Anytime it starts growing or becomes multiple, that means instead of just one little lump, you have multiple lumps growing, then it's probably time to be a little bit more careful and consider doing a biopsy to remove it. But if it's still very small and it's not growing over the last couple of weeks or months, then the likelihood of it being dangerous or cancerous is quite low. So it depends on the reason for doing the surgery. So for example, if it's because, like I mentioned before, the thyroid gland has it looks like a butterfly shape, right? There's a left side, a right side, and a small area in the middle. So if there's a benign tumor, there's a tumor or a nodule on the right side, then usually we just do a right hemithyroidectomy, or you just take out the right half of the thyroid gland, you leave the left side alone. Unless it's cancer. If it's a large cancer, then usually you have to take out the whole thyroid gland. But the other reason why you might want to take out the whole thyroid gland is that if the whole gland is very, very large and causing compression, then you might have to take the whole thing out. But in general, most of us try to preserve part of the thyroid gland, especially for patients who are younger, because then you probably don't have to be reliant on the thyroid hormone replacement, the tablets that you have to take every day. Because that's the main thing, that's the main issue with taking out the whole thyroid gland, because then you need to replace the thyroid hormone by taking it orally for the rest of your life after removing the whole gland. I hope that answers your question. After RFA, as in you did radio frequency ablation of the is it the lump? Is it a thyroid lump? I'm not clear about what the RFA. I assume you're talking about a thyroid lump or thyroid nodule. Usually for RFA after thyroid nodule, the nodule is still there, and there is always a risk that the tonsil can get enlarged. I mean, the thyroid nodule can enlarge again after that. So it's still important to monitor, especially if you did the RFA not too long ago only. I would usually routinely still monitor patients after RFA of the thyroid nodules. And it's one of the most important thing about remembering RFA for thyroid is that you need to make sure that the nodule is not cancerous. So the recommendation is that you need to have at least 2 separate biopsies to show that this nodule is not cancerous before you do a RFA. But generally, I would still monitor the nodule. That means I will still repeat ultrasound scan to monitor the nodule to make sure it's not going to get enlarged, because there is a chance of it growing a bit. So the first question is, can thyroid patient? The answer is yes. You should still get the thyroid vaccination. You should still get the COVID vaccination, even if you have a thyroid nodule or thyroid disease. Which vaccine would be better for thyroid patients in Singapore? There is no evidence to show that one vaccine is superior to another in a patient with a thyroid disease. But overall, I would say that most of the approved vaccines has been shown to have a quite good safety profile, with the exception of AstraZeneca is now having some issues because of the cases coming out of Europe about increased risk of clotting disorders. So I know that some of the European countries has temporarily halted the use of AstraZeneca vaccines until they have more information with regard to that risk, but not pertaining to thyroid itself. It's just a general other kind of side effects that is associated with the AstraZeneca vaccine. But in terms of the other vaccines, I'm not aware of any data to show that it's superior for thyroid patients. So it's equally safe.
Jangan lupa like dan subscribe.